Hi, Swara, can you hear me?
Yep, I can.
Alright, so I'm Soumya and I'm the Director of Operations at RutuChakra. So, first of all, thank you so much for agreeing to have this interview and session with us. So, why don't we just start off by you just telling us a little bit about your organization?
Definitely. I began the Period Society at the age of 16, motivated by my personal experiences with the menstrual taboo growing up in India. And I also worked as a volunteer at a hospital in a pediatric oncology ward. And when I interacted with women who came to support their family members who were undergoing treatment, I figured out that because the cost of treatment was so exorbitant, they didn't have money to buy menstrual hygiene supplies. And that's when I discovered period poverty in person. And I personally couldn't think of going for a day without my period products and just be difficult to like carry out my daily routine and focus on anything. So it completely blew my mind the fact that there were people around the world who had to carry on their periods with pieces of rag, ash, grass. And that's when I decided to begin the Period Society, both with the motive of breaking the stigma surrounding periods through our educational sessions and also distributing sustainable period products whenever possible to people who couldn't otherwise afford them. And we operate on a chapter model. So far we worked in Mumbai, Kolkata, Gujarat, and parts of Karnataka. And we've reached over 5,000 women through our educational sessions and distributed period products lasting for the next 3 years to over 2,000 of them so far.
All right, so the cause is great, and we've heard a lot about your organization. So, along this way, have you ever faced any kind of challenges or setbacks? Because taking up an issue like menstruation can be challenging at times, because even today the issue is not exactly accepted by a large audience of people. So, did you face any significant challenges along the way?
Definitely. So even before I began the organization, just with the attitude surrounding menstruation that you mentioned, I faced a huge challenge at home because even though my parents are healthcare professionals, I feel that the menstrual taboo is pervasive. It affects people from every section of society. My parents are doctors, and do they know that menstrual blood is not impure? Yes. But did they still enforce the taboo at home and expect me to not talk about periods in front of men or the male members of my family, or not go and worship when I was in my periods? Also, yes. So I feel that combating the taboo at home, and they say charity begins at home, getting my family members to speak about it, breaking the silence with my dad was really difficult for me because earlier when I was in my periods and I asked him for a pill to ease my cramps, he would ask me to go and talk about girl things with my mom. And I felt that before I went out and I educated people about periods and told them it was not taboo, I had to break the silence at home. So, I had to have some serious discussions with my parents and tell them that you are, like one of the privileged few in this country who could actually like complete your secondary education. You went to medical school, you know what female reproductive health is, and you know that this isn't impure. If anything, it's an indicator that I'm healthy. It's an essential biological process, nothing less, nothing more. And I feel that it took time to break the taboo at home and convince my parents to support me and the importance of speaking out about this issue in society, because a lot of people do get offended when you question the menstrual taboo, a lot of practices that are enforced in menstruating women. So you really have to stand your ground and kind of explain the biological process to them and keep questioning the rationale, and eventually empower them to make the choice themselves that they don't want to consider menstruation impure. And apart from that, when I actually began my organization, I feel that something that even you will be able to relate to as a youth powered organization is the fact that people think you're too young to start at the age of 16.
Right.
So in the beginning, when we called up people for collaborations or to host sessions together, a lot of people questioned the fact that we didn't have credibility, and more than that, they were like, "You're 16. Do you know what you're talking about? This topic is a taboo. It's something that's offensive." And they often didn't reply to our emails, or when they replied, they were like, "Sorry, we aren't interested in hosting an initiative like this." So I feel that the way I went about that was looking for other like-minded youth-run social enterprises and youth-run organizations and collaborating with them, because I think they would respect and understand where I came from. So our first collaboration was with Enactus at HR College, which is a youth-run social enterprise which manufactures reusable sanitary napkins, and
All right.
we collaborated with them, and we held sessions with the outreach team who found places for us to kick off. And I feel that our credibility definitely built after the first couple of sessions. But I feel that beginning as a Gen Z powered organization is definitely very difficult, because people think you're young and woke, activism and advocacy is only lipstick and rage. And you need to tell them that Gen Z isn't the future of the world. We're already taking lead. If we want to make change, we're already doing that. And a lot of people will, generations have sat through the stigma surrounding menstruation, and they've accepted the menstrual taboo. But I feel that what's special about our generation is the fact that we're defiant. And if something doesn't make sense to us, if something is rooted in superstition, if something is so illogical and something hinders gender equality, we're going to question it, we're going to take action against it. And I feel that I'm definitely grateful for the fact that I got organizations which collaborated with me. And I feel that it was important that I was resilient in the beginning, and I didn't take the rejections or the initial setbacks personally, because I feel that we definitely grew a lot as an organization from that on. So, yeah.
That's great. So, like you said, that the challenges started at home itself with your parents, right? So once you were able to sort of overcome that, like you said, you conducted a lot of educational workshops and everything. So how exactly did you sort of connect with the people you were talking to? Because like you said, since we're all youth run organizations, it is sort of hard for people to sometimes take us seriously and actually look into what we're talking about. So, how exactly did you connect with all those people and sort of explain to them that, yeah, it's something you need to accept, it's something you need to take seriously and address as a large audience, not only as individuals?
So our audience mainly comprised people from low income and marginalized communities when we started out, because we had like a twofold mission of combating menstrual stigma and period poverty. And I feel that in the beginning, what helped us connect was the fact that we spoke with communities. We didn't speak for them. We didn't go into a community and tell them that, whatever your religion told you is wrong, your cultural beliefs are wrong. We went in and we started a conversation with them, which is a two-way exchange rather than us coming and, spilling information to them and expecting them to accept it. So in the beginning of all of our sessions, we sort of have an informal discussion where we ask our audience, have you ever experienced a period taboo when you were growing up? Did someone ever tell you not to worship when you were menstruating? Did someone tell you not to touch the pickle jar when you were menstruating? Were you asked not to cook when you were menstruating? And then we ask them what they think menstrual blood is. And you'll be surprised at the number of people who think it's ganda khoon or dirty blood. And I feel that India, like in a lot of schools, we lack a reproductive health curriculum, a proper sex ed curriculum. In my own school, which was a top ranked private school in Mumbai, I never learned about periods until I was in the 10th grade.
Right.
And that was a long time. Like, it was after almost everyone started menstruating. And, for 3 or 4 years, like, all of us believed whatever we'd been told at home about menstrual blood being impure. You can't do this, you can't do that. So I feel that after we begin that conversation with everyone, we show them the menstrual cycle and the reproductive cycle with the help of visual aids, diagrams, and charts in a conversation, and we illustrate it for them graphically in their native language. And once they understand all of that, it conflicts with what they've been told and what they've been brought up with their entire lives. So then we begin a Q&A session where they can ask us questions about everything that we told them. And that's when, we see that curiosity spark and people want to kind of understand what menstruation actually is. And there's also this kind of relief when they know that they aren't impure or there isn't anything dirty. It's something normal and biological. And
Right.
once they understand the process, we ask leaders in the community to continue the conversation after we leave. And that's how they're empowered with the sense of agency or the sense of choosing what they want to believe themselves. And we just go in and we give them the information, we give them the knowledge about what menstruation actually is, and we spark that curiosity in them to question everything that they've been taught since they were young. And then they make that choice themselves. And I feel that that is a lot more organic, because no one wants someone to come in and tell them what to believe and what not to believe. So that's the way we go about bridging barriers with communities we've never interacted with before.
Right. So we've seen that on your organization promotes a lot of promotes the topics of menstrual equality, period poverty, and these are issues that a lot of us have to address, not only in India but globally. So, what exactly would be your thoughts on the issue of period poverty?
So my thought on the issue of period poverty is that it's really rooted in the fact that people still consider menstruation to be a girl thing, and women's rights globally aren't equated to human rights. So when I was in 2014, when I was a 12-year-old, I attended a Model UN conference, and there was a speaker, the prominent journalist Faye D'Souza, and she talked about how at that time in India, sindoor, which is like this vermilion that married women
Right.
wear, was considered important because of its cultural significance, and it wasn't taxed. But at the same time, menstrual hygiene products were taxed because they were considered luxuries. And even in the United States, we have the pink tax or the tampon
Right.
tax. A lot of states tax menstrual hygiene products because they're considered luxuries or they aren't essentials. And it disproportionately affects women from low income communities and marginalized communities who often have to think between choosing their next meal, choosing to fund essential things like, their clothing, their housing, paying the bills, or buying period products. And something that is so necessary to conduct, your everyday life, to be able to go to school, to be able to work, to be able to live with dignity, and to be able to take care of your own health is considered a luxury because people don't talk about menstruation. We've always thought about it as a girl thing, as something that is taboo, dirty, impure. And we've never really thought about women's right as a human right. So my thoughts on period poverty definitely are based on the idea that people need to equate menstrual equity with a human right, menstrual hygiene products with a human right, because at the end of the day, having a menstrual hygiene product means that I'm able to go to school, I'm able to live with dignity, I'm able to take care of my reproductive health, and I'm able to reach my full potential in society. And there's so many statistics about how in countries where women have achieved some semblance of gender equality or able to enter the workforce, that GDP per capita is higher, that it's an indicator of economic prosperity. And people don't see the intersection between menstruation and all of these issues, which is why I feel that period poverty is exacerbated. And it's important that people start considering menstrual hygiene products human rights, and understand that just because you consider something taboo or you consider something to be impure, it doesn't mean that people will stop having periods. People will be able to manage their periods without all of these menstrual hygiene products. So I feel that we need to focus on low income communities, and it even comes from a place of privilege, because period poverty might not affect you or me, so we don't really know or put a lot of thought into it. But we're the people who have the privilege to make change. We have access to the resources to make change. So I feel
Right.
that it's important that we think of our progress as a community and not as an individual, and advocate for tax-free periods and for the ability of people to access period products regardless of their economic status.
All right. So, like you said, that we need to sort of target the low income communities and establish inequality when it comes to menstruation itself, because the resources shouldn't be available only to the urban population but to the rural population as well. But apart from that, I think like we've seen on your in your organization, that there is a concept called sustainable menstruation as well. So, how important do you think is that? I mean, apart from exactly establishing equality amongst menstruators, we should establish the topic of sustainable menstruation as well.
So I feel that sustainable menstruation is important just given the climate surrounding environmental justice and the situation that we're seeing with climate change. Because, I was someone who always considered myself to like be a pioneer of like living a sustainable lifestyle and, making all of these healthy choices for the environment. But one day I just took a step back and, I was looking at the stash full of my sanitary napkins that I was going to throw into the dustbin, and I just wanted to find out how long it took for one of them to decompose. And there was so many statistics that just popped up in my face. And one of them was that I'm able to produce 125 kilograms of menstrual waste in my lifetime, and a single plastic pad can take 500 to 800 years to decompose. And especially in India, we know the problem that we have with landfills, which are just filling over capacity. And people coming in contact with menstrual waste which isn't properly disposed. And that's why I felt that often ignored and a huge contributor to plastic waste is waste from plastic sanitary products that we use. That being said, I have to acknowledge the fact that choosing to switch to sustainable menstrual products is not an option for everyone. The people who
Right.
live in areas with low water supply or no water supply, who cannot afford to, wash their reusable cloth pads or switch to a menstrual cup depending on the amount of sanitation and the facilities they have. But I feel for whoever has the privilege and whoever has the ability to do so, we definitely try to encourage using cloth pads because they're biodegradable, they last longer, they have a single PUL layer within them, and the amount of menstrual waste that it cuts down is drastic. And at the same time, it's a really economic and cost effective option for people from low income communities, because the amount that you spend on menstrual pads in the long run is a lot more compared to the amount that you'd spend on a plastic pad for a reusable cloth pad for 3 years. Because while the initial price might seem 3 to 4 times higher than a pack of plastic sanitary napkins, over 3 years it's actually a lot cheaper. Which is why we conduct a water assessment of places we go into to conduct our sessions, and whenever possible we introduce people to cloth pads, and if they like the idea we encourage them to switch to those pads, and we distribute them free of cost.
So, like you said, that we need to introduce alternatives to sort of like imbibe the concept of sustainable menstruation itself. But how accepting are people of this new idea? Because since, I mean, there change takes a lot of time to sort of take place and to be accepted by a large number of people, because some people, most of the society is sort of just grounded to old ways, to cloth, or to sort of just the disposable sanitary napkins. So how accepting were people of this new idea?
So I'll definitely say that I got a lot of questions about the cloth pads that we distributed in the beginning, because people were like, what is the difference between this and the tattered rag that you advocate against? And people had concerns about health, and we had to explain to them that this isn't a regular piece of cloth. It has a PUL layer, and it's manufactured, certified, and it meets certain hygiene standards for us to be able to distribute it to you as a product. And I feel that it was definitely easier to advocate for the idea with school children, because they're more receptive to all of this. They're young and they're learning about environmental justice and climate change in their own classes, and we're providing them with a way to kind of advocate for the same in their real life. And with adults, it really depended. So at times when we conducted sessions in rural areas, a lot of the people we worked with already used a piece of cloth, and it wasn't able to hold blood. It was difficult for them to carry on with their periods with that piece of cloth. But when we told them that this is basically like the based on the same concept, but the fact is that it's like a plastic sanitary napkin, and the fact that it can absorb all of your blood and it has liners in it to adjust according to your flow, they were definitely really happy to switch to this because it was a lot more comfortable, it was hygienic, and it was a better option that was provided to them free of cost. It was a little more difficult in urban slums where people might have had access to plastic sanitary napkins, but the issue out there was that they kept the napkins in for 12 to 16 hours, which isn't advisable because of period poverty and because they wanted to kind of save on the napkins for their next cycle. So there we had to tell them about how comfortable this is and speak from personal experience. So before going in and talking about the cloth pads, I definitely had to tell them that I used the pads myself and I had to try it and give them my honest feedback and answer their questions and tell them that I had a rash-free period. It was a lot better and a lot more comfortable for me using this compared to a plastic sanitary napkin. And I feel when you go in and advocate for the product in the community, it's important that you've used it yourself. And there are other sustainable menstrual products which are definitely a lot more difficult to introduce specifically in India, including menstrual cups and tampons, because
Right.
the way of use is a lot more intimate, and you have to insert them within your body, and it can be uncomfortable in the beginning. And there are all of these myths surrounding virginity in India, which are associated with a menstrual cup, and the chance that you can break your hymen or whether it will cause any disease, and people are just uncomfortable with using something that is so intimate. So we're gonna begin our menstrual cup module soon because we acquired sponsorship from a company, but we'll definitely have to do a need assessment and identify a population which will be willing to use the cups. And before going in and distributing it to them, we're planning to conduct several sessions to speak to them about the cups and provide them other alternatives and let them choose. So I feel that with things like tampons and menstrual cups, like before we begin distributing them and introducing them in communities, it's important to have awareness sessions and conversations to burst the myths and the taboos that surround their use, and then slowly make our way into actually promoting the use in communities. Because as you said, it's very difficult to change these notions that you held over generations and to accept a new product. So the two things, to sum everything up, the two things that are important to do is one, definitely engage in conversations about the products and let people make the choice to use them. And secondly, when you advocate for a product, make sure that you or someone on your team has used it before, so that when people can ask you to vouch for its credibility or ask you questions about its use, you're able to honestly answer them from first-hand experience.
All right, that's great. So, Swara, as you know, that apart from your organization and our organization, there are numerous organizations who have taken up the issue of menstruation and menstrual hygiene, and they're trying to promote it. And as we see that over the years, there are certain sections of people who are opening up to the issue altogether, not only in urban areas but also in rural areas. So, how exactly do you see the future of the acceptability of menstruation, not only in India but globally?
I feel globally, menstruation is definitely becoming a lot more normalized as opposed to any other time in the past. But that being said, I feel that there's still a lot of work to be done, because there's still like over 80% of India's menstruating population which does not have access to menstrual hygiene products. And these statistics are true in a lot of countries too. And even in the United States, periods are a taboo. But the way I see all of this changing is definitely through conversation, because um, menstrual stigma, period poverty aren't separate topics, they're definitely interconnected. And the way we can go about busting them is by having conversations. And when you talk about something frequently, when it's a part of your daily life, and when you don't hesitate to speak about it, I feel that that's when it automatically stops being a taboo or a word which is associated with stigma, which is why I feel that once you begin, you know, accelerating these conversations that you have on menstruation, and these new nonprofits reach different parts of the world, different parts of India, and we work in collaboration to talk about periods. That's how I see the future of the menstrual movement changing and going ahead. And even within India, I feel that it's not just as organizations, but we have to partner with businesses to take up corporate social responsibility, partner with individuals, reach communities to speak about menstruation, like within their own little sphere of influence, and even partner with existing institutions or schools or colleges, because I feel that that's where you're supposed to ideally, strike the iron when it's hot, like begin the conversations about periods with young children so that they don't grow up with these notions of menstruation as a girl thing, or menstruation something's dirty. And I feel that when you hit schools or places of education, you kind of target an entire generation. And when people don't grow up with the taboo, there's no one to perpetuate it. So I feel that as these conversations kind of begin and they start taking root in educational institutions, I can definitely envision a entire generation in the future where menstruation won't be a taboo.
Right. So, as you know that right now we're in the middle of a huge pandemic, and because of the entire idea of social distancing and quarantine and lockdowns imposed here, it has if affected menstruators all over the world, especially the people belonging to the rural communities. So how exactly do you think that even by sitting at home we can spread awareness about menstrual hygiene and the importance of menstruation, along with breaking the taboos of the same?
So, one aspect of it you mentioned is service or reaching out to menstruators who belong to migrant or rural communities and are definitely disproportionately affected by this pandemic. And I feel the way you could be a part of that is definitely by volunteering your time to donate these menstrual hygiene products while on ground, while following social distancing practices and whatever the guidelines are set by the government or the municipality of the place where you live in, and also donating to fundraisers or causes which are trying to provide menstrual hygiene products to people who can't afford them. And I also feel that it's definitely about bringing to light the fact that period poverty is a thing. I feel that a lot of people still don't know about period poverty. So a lot of fundraisers right now, which are launched by major companies or individuals or celebrities, are definitely doing great work in migrant relief. But in the entire package of producing essentials, including soap, food kits and other things to carry on someone's daily life, they fail to include sanitary napkins or menstrual hygiene products, because we don't talk about periods so often that we kind of forget that it's important for people to just have menstrual hygiene products to carry on their lives even during a pandemic. So sparkling conversations with people who are running such initiatives and talking to them about period poverty and advocating for them to include menstrual hygiene products in their relief packages if they can is definitely a great way in which you can reach out to migrant communities if you can't do something by yourself sitting at home. And also like we had a live session today and people tuned in and we're talking about periods. I feel that social media is definitely a way to kind of bridge every kind of gap that you have, and just within yourself, within your circle, to talk about periods. So by hosting more live sessions, by hosting digital panels where you talk about menstrual inequity, and kind of collaborating with other organizations which are working to spread the word in different parts of the world, and also to compile a digital toolkit where you can conduct menstrual hygiene education sessions online, which is something that we're doing, where our content board is currently focusing on creating a digital toolkit to talk about periods and facilitate an interactive session which parents, educational institutions, and government bodies alike can use to facilitate educational sessions and learn how to conduct them by themselves with the help of a pamphlet and with the help of all the resources that we use to conduct the sessions in person. So I feel definitely we shouldn't underestimate like the power of social media or just a digital space to spark a conversation. And also, as I said, we need to reach out to organizations which are conducting fundraising or relief efforts, or take on the responsibility ourselves and educate them about period poverty to make sure that menstrual hygiene products are included within these relief packages.
So, like I said, that the pandemic has not only affected people from the rural areas, sorry, urban areas, but also from the rural areas, and drastically in the rural areas. So, have you come across any sort of instances where people have faced the lack of resources, or they've been in situations where they're not able, I mean, they're not able to get out of such situations because they're not able to move around and get access to resources as easily as it were on a normal day.
I've definitely experienced these instances because I my hometown is Gujarat, and I often was at my own village, and out there, like, definitely I come from a city, so I have my menstrual hygiene products, and I'm definitely like a lot more privileged than people who go to school there. But something that I noticed is that a lot of girls are like married off early, a lot earlier than compared to the city, and they also drop out of school earlier, and a big cause of this is period poverty, because a lot of them can't access menstrual hygiene supplies, and they don't have toilets or other facilities close by, so they feel ashamed, because they don't know where they'll change their rag or piece of cloth during their periods, and they're scared of getting a leak, or they're scared of people knowing that they're on their periods. So I've definitely heard of instances and know of instances where people drop out of school when they get their periods. And even in my own house, my domestic help's daughter used to miss school for a lot of days during a month, and at times when I asked her, she told me that there are times in the month when my flow is so heavy that the rag my mom gives me isn't able to contain all of it, and we provided her with pads. But there's so many more people out there who cannot attend school because of a lack of menstrual hygiene supplies, and it's something that I've experienced personally, because one day when I was on a flight, I fell asleep for a nap, and when I woke up, I found myself completely covered in blood because I got my period while I was in that nap. And I had an irregular cycle at that time, so I did not have period products in any of my cabin baggage, so I had to use toilet paper. And I remember that
Oh,
instance was so harrowing for me, and I absolutely couldn't wait to get out of there, go to my hotel room and like change into regular clothes. And I was terrified to ask someone in the flight for a pad because I didn't want to speak about it at that point of time, and it was my first flight alone as a minor. So that was just one day for me, but I know that for women in rural areas that can be an entire lifetime. And especially in Maharashtra, where some of my family belongs, in the villages, they have huts called gaukals where menstruating women are confined because
right.
they don't ask them to be within the house because they think they're impure and they aren't fit to, carry on with their daily routine and be able to cook, attend school. And there are instances of people dying of snake bite or suffocating to death within these gaukals, or people getting so many diseases related to reproductive health because they can't maintain their periods properly. And I definitely feel that outreach in both urban slums and rural areas is necessary because of the same. And while the period taboo might be pervasive and affect people from every section of society, men's period poverty by itself definitely disproportionately affects people from low income or marginalized communities.
So, as you said, so apart from actually spreading word of about menstruation itself and menstrual hygiene, do you think it's important to let the audience know about the kinds of diseases or the kinds of illnesses that are spread because of improper menstrual hygiene? And like we say, that we are sort of a little more privileged than the ones in the rural areas, because we do sort of have a better and clear idea about menstrual hygiene itself. But like you said, that there are a few women who are confined to areas because of taboos, and they face illnesses. So do you think it's important for us to bring up the topic of menstrual diseases as well?
It's definitely important, and in fact, it is a part of the content of our sessions because there are a lot of issues related not only to menstruation but to reproductive health that people don't speak about because they're sexualized. So when people use rags or they use their kapra, at times they tell me that it's difficult, but we carry on with it, and they don't know the consequences of using that in the long term or the kind of things that it can lead to. So we have to talk to them about that. And it's not just about diseases related to not maintaining menstrual hygiene itself, but even conditions related to menstruation. You won't believe this, but during a session that I had in the red light district, a woman raised her hand and she told me that her daughter was 30 and she didn't get her period yet. So what should I do about it? And I was surprised, like, why didn't you see a doctor till now? But people just don't want to talk about this. She told me that she spoke to other women in the community. They like gave some home remedies to do all of this, and I was just absolutely shocked at the fact that people don't reach out in medical care. They can't access medical care when it comes to things related to reproductive and menstrual health. And a lot of people don't know about PCOD, or about just what constitutes abnormal bleeding during periods, and other issues like surrounding vaginal infections that can be a result of improper menstrual health and menstrual hygiene. So we have to cover all of this during our sessions, and whenever possible we definitely try to have a gynac or any other healthcare professional on a pro bono basis who can answer questions that they have, and kind of like go into the nitty gritty of a bit more medical questions that people have, because we don't want to give them improper information. So we cover the basics, but if they have questions which are specific to themselves, or they are seeking care, or they're experiencing any kind of difficulty, we do our best to connect them to a qualified healthcare professional who can help them at a pro bono basis.
That's wonderful. So like you said that social media actually stands as a powerful medium to convey and spread awareness about these issues. So how do you think that people, apart from linking themselves to organizations like us, can sort of help with sort of help to spread awareness and help those around them? How do you think that people as individuals of themselves, not exactly taking help from these organizations, how do you think they can help those around them?
So people who want to help people around them who are experiencing period stigma, period poverty, especially by using social media, I feel that the best way to do that is just spark a conversation. And sparking a conversation doesn't have to be something serious like one day, randomly you go up on your Instagram story and you like start posting facts about period poverty. Sparking a conversation about periods can be something as easy as using a period bingo or posting a meme about menstruation, and just in a casual, fun, humorous way, making it something that you talk about, and just bringing it to people's attention, and making sure that menstruation isn't a private matter anymore. And even with your friends, not hesitating to talk about periods. I know it can be difficult in the beginning, but once you start normalizing menstruation, especially with people who don't menstruate, including male allies, and bring it up often, even they gradually ease into that conversation. So definitely using social media as a platform to spark conversations about periods, and bring to light everything that people experience with menstrual inequality, and using the art of storytelling to kind of talk about your own experiences with menstruation as you get more comfortable on social media is definitely an amazing way to spread awareness. And also just taking part in these challenges, like there's a red dot challenge going around where you
Right.
post a little red dot in your hand
Right.
and
Yeah.
post with that as a hashtag. Just people watching that on their stories and kind of getting curious about what exactly is the significance of this, and kind of seeing trends like that on social media, they'll be more motivated to go in and find out about period poverty and find out where that challenge originated from. So I feel that kind of playing on all of these trends and using meme culture, and also just using fun things like bingos to engage in conversations about menstruation, both helps you kind of begin from a comfort zone, but at the same time gradually ease into a larger societal conversation about periods.
Yeah, I think that's very much important for everybody today. So I really hope that this discussion helps everybody, not only teenagers, but people from across all age groups, to sort of address this situation, the topic of menstruation and menstrual hygiene, not only during the pandemic, but also in the years to come, pandemic or no pandemic. So, thank you so much for being a part of this discussion. I really hope that this discussion helps those watching it, and for those yet to watch. Thank you so much again. And
Thank you so much for having me today, and I definitely feel that discussions like this, which are facilitated by youth-run organizations, can target Gen Z, but they definitely apply to people from everywhere, because the conversation like about breaking the taboo is definitely intergenerational. And I'm just hoping that we can definitely collaborate in the future and get the word out about this, and just put a period to the stigma, which is our tagline.
Yes, definitely. Thank you so much.
Sure, have a nice day. Bye.
You too.